The White House says President Trump had an MRI earlier this fall to examine his heart and his abdomen as part of a preventative screening for men his age. This week, the White House released a memo from Trump's doctor calling it perfectly normal. But doctors typically order that kind of testing to help with diagnosing symptoms or to monitor an ongoing health problem. So-called preventative MRIs are not part of routine screening recommendations.
Yes, joining us this morning to talk more about this is 9 News medical expert Dr. Payal Kohli. Dr. Kohli, thanks for coming in.
Good morning.
First things first, what would prompt a doctor to order an MRI, and what can an MRI actually detect?
So an MRI is basically an imaging test done with magnets, so it doesn't give you radiation. And if you think about especially the heart, like your house, there's different components to it. So you have the walls, you have the electricity, and you have the plumbing. So an MRI really helps us to look at the walls, look at the thickness of the walls, look at the shape of the walls, look at the doorways, look at how the blood is kind of moving through the heart. And really we order it if there's something abnormal that we find either on the EKG, which is that electrical map of the heart, or if the patient has symptoms, or if they have a condition called cardiomyopathy where the heart is weak, the muscle is weak, the walls aren't working properly, or if they have something deposited in the walls. These are called deposition diseases like amyloid. So we're usually looking for problems. It is very rare, extremely uncommon, in fact. I mean, the president is the president, to order a preventive or screening MRI if everything looks normal.
Question for you, because I'm really interested in this total body MRIs, which is trending right now. We're going to get to that in a second. But for MRIs, it can go beyond the heart, right? Like it kind of like, it's like a slices of bread, right? Where it's like looking at everything, and it can look at, you know, for tumors or anything like that as well, right?
Well, it can, but here's the challenge with MRIs. They're best when you concentrate the magnet on a specific field. So a CT scan, you go to the emergency room, you have abdominal pain. They're going to order a CT scan, they look at everything. They look at the bones, they look at the organs, they look at the tissues. It's a nice kind of screening test that looks at everything because it uses X-rays, and that does have radiation. But an MRI, because it's a magnet, the magnet works best in terms of giving us most focus and resolution when it's concentrated on a field. So these total body MRIs to me are a little bit of a head scratcher because the resolution is nearly not as good as just the heart, just the liver, just the pancreas if we focused in on a specific organ.
So not really recommended.
They are definitely not recommended. And I know a lot of celebrities like Kim Kardashian and others have been proponents of total body MRIs, but here's the drawback of it, is it gives you a false sense of security because, like I said, the resolution is not as good, so you can actually miss a lot of cancers and tumors on it. 30 to 40% of the time, it leads to something called a false positive diagnosis or an incidentaloma. So reports are saying that it picks up something that's not really a problem, could even be a false positive, and then you end up having a biopsy or having to chase it after that. We do sometimes do total body MRIs, but in really rare cases. It's mostly for people who have genetic syndromes, sometimes someone who's had cancer, but even in those cases, I think a PET scan where you look for tumor activity using a radioactive glucose marker is a better test.
Okay, what other screenings would you recommend for somebody that was like, well, I was looking at doing something like this?
Yeah, so you definitely want to stick with what we call evidence-based screening because MRI doesn't reduce your risk of dying, doesn't increase your risk of picking up increase your chances of picking up cancer. The ones that do that are, for example, if you've been a smoker, you need a lung CT scan to do it. Every single person after the age of 40 needs a test called a calcium score, which is an X-ray of the heart. That tells me if you already have plaque. Remember I said there's electricity, plumbing, and walls? This looks at the plumbing. This looks at the blood vessels around the heart to see if you've already put down cholesterol deposits in those particular blood vessels. You definitely need those blood tests for screening that we've talked about. You know, the cholesterol, the sugar, hemoglobin A1C, a test called lipoprotein A, and then of course colonoscopies, mammograms, cervical cancer screening. These are all proven to save lives, to reduce risk of dying from cancer, so that's what we should do. Again, for the president, I think he's in a different category because he's the president of the United States, so it may have made sense for them to do a cardiac and an abdominal MRI, but I don't want anyone walking away from here thinking that that's a normal part of our preventive screening or they should be signing up for these types of MRIs.
Are MRIs even covered by insurance?
Well, so it depends. If you're doing it for disease, so if I found something as a cardiologist on the EKG or the symptoms that raised my suspicion for having something wrong with the walls of the heart.
And you ordered this specifically.
And I ordered it. It would be covered. But a screening preventative MRI, it's not evidence-based, so it will definitely not be covered. It'll be out of pocket. They run about $2,000 out of pocket. And again, I think it's more of a marketing thing. You think you're doing something for your health, but you're actually creating more trouble for yourself.
A lot of good information there. Dr. Kohli, thank you so much. We appreciate it. Let's